our company have a super talented 28 persons, and our focusing area is nano radioactive material. And our first pipeline is the radiopharmaceutical and biomedical drugs for like a bio applications. So I want to introduce about like a radiopharmaceutical first. And radiopharmaceutical is a radio compound which can cure many diseases, but our pipeline is curing the cancers. So radiopharmaceutical can also use it's very attractive because of this kind of radiopharmaceutical is the diagnostic materials. They can sometimes use like a diagnostic material, and also they can use for like a therapy. And recently the radiopharmaceutical is very attractive for many global pharmaceutical companies because they can enhance the cancer therapeutic efficiencies, and also they can use this kind of radiopharmaceutical with the chemotherapies and also like immunotherapies. This kind of radiopharmaceutical area is very rapidly growing annually, and there are many global pharmaceutical companies are focusing this kind of radiopharmaceuticals. But there is a lot of issues. The radiopharmaceuticals are using the radioactive isotopes, but sometimes this kind of radioisotopes are clipping into the delivery materials. And this kind of clipping problem, they can radioisotopes are transferred into the thyroid and also like the bone marrows. This is the main issues and main side effect of when we cure the cancers with the pharmaceuticals. So what we want to do is we want to solve this kind of issues and problems based on like a nanotechnologies. We can use this kind of nanotechnologies. We can sometimes conjugating iodines, this kind of iodines, actinium, and lutetium. This kind of three radioisotopes is the most popular therapeutic isotopes, and we can conjugate this kind of radioisotopes irreversibly into the nanocarriers. And this kind of radiopharmaceutical is very attractive because they don't have to penetrate the cancer cells. They can even bind into the cell membrane and into the cell membrane, and they can directly attack to the cancer DNA of the cancer cells. And this is our result. We have super safe results. We check the liver and kidneys. We have very safe results. And also comparing to the competitors, our radio material doesn't clip into the body, and it doesn't transfer to the thyroid. It means we can enhance the radiopharmaceuticals efficiency. And also we have the very good targeting data. Targeting data is about 20 to 25%, even with the IV injection. So, and also we have great efficiencies. We can have a very good cancer therapeutic effect when we cure our medicine. And also we are planning our IND into FDA next year. We are now in GLP studies in US. And our first pipeline is like a cancer, like a ovarian cancer, and second one is like a breast cancer, especially like a triple negative breast cancer and also lung cancer. We're gonna keep studying this kind of cancers first, but our focusing now is the ovarian cancer. And also we are using radioisotope as the first iodine, and next pipeline we're gonna use the actinium too. So our base is the nano structures and nanotechnology. So we are going to keep trying to go for lots of medical applications. So this is our members, and thank you for hearing me. And I hope my presentation can give you all of you for a small insight for a radio pharmaceutical fields. Thank you.
Okay. investors, if you have any questions, please raise your hand. Raise your hand, please.
So thank you for an interesting presentation. Curious to understand how you are going to monetize. Is this going to be a licensing game, or you try to sell it yourself, or what is your thoughts around how to commercialize this?
Yeah, so we are having a communication with lots of few like a global big pharmaceutical companies. Like we are having a communication with some of the kind of companies, and we also having a communication about like a license out. We are going to trying to sell our like a patent or a technology. So we're going to keep trying to communicate with like a big pharmaceutical companies. Yeah, that's our business model.
Hi, excellent presentation. Can you go back to the slide on the efficiency?
Yeah, sure.
So what was that? So yeah, the next one.
Yeah.
Yeah. So what the target efficiency is 15%.
The minimum is 15, and the maximum is 25. The average is like a 20%.
And what have you reached today?
Pardon?
And what part of the 15% have you done 10%
Oh,
already?
yeah. This is IV. So this you can see that this is This is the control.
Yeah.
And we injected like an IV, like a tail bill.
Yeah.
IV
Yeah.
injection.
No, but I'm wondering is that have you reached any of these KPIs already, or are you on the way? Have you proved that repeatedly that you are able to get 15%?
Yeah, so absolutely, yeah. So we are keep trying to get more better like a result, but this is like early data, but we're keep trying to.
And this data comes from a clinical trial, phase 1.
Oh, phase 1, yeah, not phase 1, yeah,
Okay.
preclinical stage, yeah.
It's a preclinical trial,
Yes,
so it's
absolutely.
not certified.
Yeah, absolutely.
Okay, right. And the next question was at the end, if you go back to the partners, you had a huge list of partners and investors at the end.
Okay.
Yeah, so these are major companies in the space. So is there a table somewhere, just feedback, it would be good to have a table somewhere saying what does the Harvard Medical School do with you guys? What does Samsung Medical Center? Like what is the level of this partnership? Is it a logo? Is it a white paper? Have you done a pilot together? What kind of investments is coming? Because this doesn't tell me much about the depth of the engagement.
Yeah, right. So we are our funding stage is after Series A,
Yeah.
and also we are now in funding for we are now in bridge funding. So we are all collaborating with the Samsung Medical Hospital, and also in US we're having a collaboration with the Mayo Clinic. So that's why we are going to study after a preclinical stage. We are going to study our clinical studies with the a Samsung and hospital, and also like the Mayo Clinic too. So that's our plan.
Okay, all right, thank you.
Okay, thank you.
A quick follow-up question, if we have time. The time scales for number 1 to FDA approval, time scales to market, time scales to potential acquisition, liquidity investor. What would be your time scale perspective?
So we are now in stage in like a GLP studies. So I think our GLP study is going to be finished in next year, and we are going to submit the end of 2023 for like an IND and FDA. So after an IND, we are going to study like a clinical trial. So that's why we are now having a conversation with the global pharmaceutical companies lots of players in Europe, and also US. So that's why we are having a conversation with them for the license.
So we have 1 more minute. I'll take the last question if there's any. Yeah, British.
So, with respect to your clinical trials, can you explain by 2026 or on phase 2 of safety and efficacy on 2027, how much money would you need to complete all the clinical trials and get a license? And second is, at what stage do you become a lucrative option for all the pharmaceutical companies with the data that you produce through the clinical trials? At what stage do you become a a good target for them to license this technology or probably acquire it?
So our strategy is we're going to try to license out and when we are doing like a clinical phase 1. And also we already have a funded, so like I think more than like a 15 million we already have it. So I think about like a 10, I think we may need like a 10 million more to finish the like IND studies because we need a GMP. So we already set up the GMP, but we have to change our non-GMP site to GMP site in US. So we set up our GMP in Indianapolis in US and also in Samsung Medical Hospital. So that's why we already got like a 15 million, but I think more 10 million we can finish our IND process.
And what stage do you become lucrative for pharmaceutical companies to kind of look at too? For licenses or
You mean when?
Sorry.
You mean when?
When? Yeah. At what stage?
We in phase 1.
Phase 1.
Yeah, clinical phase 1 after like IND.
And second question is on cancer.
Sorry, Prakash, I'll have to stop you there. You can ask them later.
Thank you very much.
Please give applause for GTI Biosciences. Thank you. Thank you. Next